Hello everyone, this is your host Rohan Tundell from InnoHealth Magazine Studio. I welcome you to this podcast produced by Innovation Curious with a mission to spread awareness and knowledge of various facets of healthcare innovation. You are listening to the Voices of InnoHealth Podcast from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this podcast, we invite various industry leaders and discuss their views on the healthcare industry and innovations. Today, we are going to have a conversation with Dr. Sanjiv Kumar. Welcome, Dr. Sanjiv, to our podcast. How are you today, sir?
I'm fine. Thank you, Rohan.
So, before starting, I would like you to tell us a little bit about your career path and your journey up to this point.
Okay. Thanks, Rohan. To put it briefly, I did my medical degree from All India Institute of Medical Sciences. Then I drifted into Indian Army, worked there for 5 years. Came back after completing my short service commission and did my MD in preventive and social medicine. And after senior residency in AIMS, I joined as lecturer in preventive and social medicine at University College of Medical Sciences and Guru Tegh Bahadur Hospital in Shadra. And then I got selected in UNICEF and I worked in India in Jaipur office of UNICEF looking after Rajasthan, then moved to Delhi. And then I went international. I moved to Iraq of Saddam's days, where there was a lot of problems because of sanctions, and contributed my bit to improving situation of women and children, which are the target group for UNICEF. Then I moved to Geneva. I was regional advisor for health, nutrition, water and sanitation, looking after 22 countries. These were the countries which had recently been moved from communist economy to market economy, former Soviet countries and former Yugoslav countries. Interesting exposure, came to know health infrastructure. Even if it is better than the West, you need a lot more to improve health of a country. And from there, I moved to UNICEF Nairobi. I worked in Kenya, Malawi, and Uganda. Also went on an assignment to Bangladesh. And then, homesickness took over. So I quit my job about 3 years before I was due to retire. Came to India and joined as Professor of Public Health and Dean Research, Training and Publications at International Institute of Health Management Research. And then I moved to National Health System Resource Center, a government institution where I worked as Executive Director and providing technical support to all 36 states and union territories and government of India. And one of the major achievements I feel proud of is contributed to writing of National Health Policy 2017. And that is when I came in touch with technology. And I'm not a technology person, but I became a fan of how technology can contribute to improving health in India. And I am a very strong supporter of technology to be identified and scaled up so that we can address the bottlenecks we have in providing health services to the people at large. So that's in brief about my journey so far.
That's quite elaborate and inspirational journey, sir. Now, coming to the podcast, for my first question, what does healthcare innovation mean to you?
Healthcare innovation, essentially, I look at it, it has two parts, Rohan. One is program innovation and second is technology innovation. And both are essential, and many times you have overlap between program innovation and technology innovation. Program innovation is you look at how can you improve planning, how can you have inputs into planning so that you address equity, you improve access to healthcare. How the interventions can be delivered to population. For example, immunization. We are in COVID times. Everybody is talking about reaching out to near 100% of people with vaccine. So that's one way. You look at mobilizing community. You look at providing services at the doorstep so that people can avail of the services. So this is one part of it. Second part is in more exciting, though I'm not a technology person, so I don't know much about it. But that is how technology devices or technology being used in other sectors or new technology being developed can help in improving access. In COVID time, to give you an example, we have a platform called CoWIN. CoWIN platform has been developed adapting the old platform we had for electronic vaccine information network, in which all the vaccine we had in the country could be traced right up to service providers level at the vaccination center. So it has input from the manufacturer right up to the grassroots level where it was used. That has been strengthened further. And now you can fix your COVID vaccination appointment. Those of us who are on this side of service delivery, we know we will get reminders, your next vaccine dose is due. You can come back home and print a certificate from the website. You can ask questions, and questions related to COVID or COVID vaccine can be responded. On the program manager side, they can monitor vaccine right from manufacturer to the central store, to the regional store, to the vaccination site, and how the vaccine has done, including if the vaccine has been exposed to high temperature and it has lost its potency. So these are technology innovations. You have telemedicine, you have teleconsultation, telepathology. There's so many applications of technology which you can bring to improving access to healthcare, bringing down the cost of healthcare, and also improving quality of healthcare. So broadly, I look at healthcare innovation in these two broad categories.
Yes, I would agree that mobilizing the resources in such a way that it's reached to maximum capacity and reducing the cost by keeping a proper track of everything is a good way to innovate. So now for the next question, we've observed trends in both direction for various industries during COVID. So the question to you is, how did the COVID pandemic change your perspective on healthcare, especially when it comes to innovation?
Yes, Rohan. It is a different world altogether, not just in healthcare service delivery, but overall also. And this is not going to return to what you used to have before COVID time. And technology has come in a big way during COVID time. Yes, in healthcare, but look at overall. Schools being run. Even small children having virtual classes, webinars, conferences, meetings, everything has become virtual. People working from home, the whole team has become a virtual team. You don't see maybe for months or even years together the people who are part of the team, and you're working with them virtually. And it has been found, at least in many areas, that this system is more efficient. People don't have to waste time in commuting to work. They don't have to invest so much in developing office infrastructure to get everybody around. So, the thinking has changed. We were forced to do it, but there are many, many learnings we have had. Coming specifically to health, in COVID time, especially during the second wave in India, when we had very large number of cases. First wave, we had about 100,000 cases. In second wave, we had 400,000 cases. And the number of cases shot up much faster than it did in the first wave. So we had large number of cases who became sick, but the hospital got overwhelmed. I mean, it got overwhelmed everywhere in US, in UK, in France, in Italy, and many developed countries. So we are a developing country, and our infrastructure is not as robust as they have in the West. So we got overwhelmed. What we learned, and in fact, what we were forced to do is those who have mild disease or asymptomatic disease, but they were tested COVID positive, they can be treated at home. And then their investigations came to doorstep. Medicine delivery came to doorstep. We had some companies like 1mg and others who were providing medicine at home. So you scan the prescription of the doctor whom you have never seen. The doctor sends you a prescription, takes a picture, sends it to you. You forward that picture to the dispensary, and the medicine is delivered at home. Doctor orders some investigation. You transfer that request for investigations to the laboratory. The laboratory comes home and they take your sample, and you get the report without walking out of your home. So that is one aspect. In primary healthcare, we had a concept that you have health services being delivered at your doorstep. So in fact, through home care, primary healthcare component of healthcare services was made available. It has many advantages. One, you don't have to walk out of home. If an infected person, Rohan, walks out of home and comes in contact with you and 10 other people, he might give infection to you. The epidemic would have spread much faster if these people were queuing up for lab tests, queuing up for collecting medicines, queuing up to be seen in the outpatient department in the hospital. They would be infecting those who were not infected. So that was one public health advantage, that those who were infected could stay back at home. Yes, there were precautions to be taken for their care at home, and rest of the family members who were not yet infected, they have to keep a distance, observing all COVID appropriate behavior. But this model is very appropriate for care of non-communicable diseases. To give you an example, if somebody is a diabetic, he doesn't need to stay in the hospital. His blood sample can be taken. He can talk to the doctor through teleconsultation, and he can get medicine, and he can order medicines online. Medicine will be delivered. He gets the investigations done again, as doctor advises, maybe a couple of weeks later. He looks at the blood sugar levels and then adjust the medicine, or maybe add another medicine, or reduce the dose of the medicine, and so on. So you had healthcare delivery for most of the chronic conditions which can be provided at home. Patients are convinced now. Doctors are convinced now. They will not insist in your coming to hospital, Rohan, if God forbid you have any of these conditions. You will also not feel like being a diabetic in this environment of pandemic. If I go to doctor's clinic, I may come across somebody who's COVID positive. Now we are looking at COVID as one example, but somebody can have flu. Somebody can have tuberculosis and transmit the disease to the other. So your exposure to infections is reduced. And if a diabetic gets any one of these conditions, severity of the disease is much worse, and adverse outcome is also likely to be more common in them. So this learning from COVID time has really changed our thinking of healthcare providers, the patients at home, and community at large. To give you an example, we did a study on 700 people who responded to our online request. Their experience of teleconsultation, about 80% of these people had teleconsultation for the first time in their life. If they did not have connectivity to internet, they could pick up the phone. Everybody in India almost has a mobile phone. They could pick up the phone, call the doctor, get the consultations. If the doctor wanted some reports, get the investigation done, send the picture to the doctor, and treatment could be provided. So 80% of them used it for the first time, and most of them are satisfied. Why are they satisfied? One is they don't have to get out of the house. Especially those who are not fully able-bodied, they can't walk around, can't drive. For them, it is a difficult task to hire a vehicle or get somebody to take them to hospital, then wait there, then bring them back. So it's a very cumbersome task. If these things can be handled sitting at home, they are very happy. Only in situations where interventions are required, like in COVID time, in somebody had breathing which became faster, or had any other complications, the fever did not go down, or fever had gone down and then came back again, these people may need hospitalization. Only they need to go to hospital. Similarly, learning from COVID time, if somebody goes into diabetic ketoacidosis, blood sugar is not controlled, gets into complication, or gets damage to the eye, to the heart, to the kidney, or other parts of the body, these people can access the hospital. The workload on the hospital will be less. Only those who really need hospitalization will go to hospital. Looking at it from the doctor's point of view, I talked to some of them. For example, a gynecologist who is a cancer survivor, and she is around 65. She was out of circulation. In COVID time, the cancer survivor, still not fully treated, I would say, not fully cured of cancer, was advised stay at home, don't come to hospital. She was very happy. She came back into mainstream. She was giving consultation online, sitting at home. And when I talked to her, she had given consultation to more than 2,000 patients without being exposed to the infection. So many of the doctors who were sidelined in times such as the epidemic of infectious diseases, they were brought back, and it gives them immense satisfaction. They can contribute much more to the profession of which they have been part of for the rest of their lives. So this is the perception which I'm seeing has changed. Even in my home, I have my mother-in-law who's a cancer survivor. She is on treatment and needs frequent consultation. Now, most of the time, the consultations were online. On one occasion, she needed intravenous medication. So we contacted a healthcare personnel provider. You have many of these agencies in Delhi. He sent a trained nurse who was able to give her intravenous injection. We ordered the medicine online. It was delivered to where she stays, and she got all medication. And within a couple of days, she recovered, and she was fully back to normal. This is one major change which has occurred. Coming to another aspect, we talked about COVID application. Earlier, many of us were, allowed to take appointments online, going to a hospital or a doctor, but many people were not comfortable. Applications such as COVID have made people comfortable. You want to see who in your neighborhood is suffering from COVID infection, you get that information in 500 meters radius around you. You have so many cases. So you are careful. If you go out, you have to observe these precautions. Messages come online. You can fix your appointment for vaccination online. You will get reminder for the second dose. You can come back home. Travel is restricted. You need a certificate. You don't have to go anywhere. Just go online, you got the second dose, print out the certificate with Modi ji's picture on it, and show it to the airlines, or when you're crossing borders, show it at the border, and you can move around freely. Earlier, we had to apply, give me this certificate. It will make you run around from one office to the other, and finally, after many hours of running around, you will get a certificate which is stamped. And nobody is looking for stamp on these certificates anymore, because the virtual certificate you have, you can print a copy and then take it anywhere, and everybody is accepting that. They can verify. You have what do you call it, QR coding. Anybody can verify taking picture and make sure that what you are saying is correct. So teleconsultation is one area, home care is the second area we talked about. With home care, you will have better access to healthcare. You will have more cost effective. People don't have to spend on transportation, queuing up. Maybe for one consultation, half a day is gone. The patient has to, take leave or be away from work. One attendant has to be away from work. All that hassle has reduced the cost of care, and you get the best quality doctor. Many of these doctors you get online won't be available to you. You keep running around and you won't get appointment. Here, you go online, convenient time when the doctor is free, today, tomorrow, day after, you take that appointment, you consult with that doctor. So the third is lab at the doorstep, and the fourth is medicine at the doorstep. So this is what COVID has done, and I'm looking at the silver lining. Yes, it was a difficult period. We lost many precious lives. Many people have lifelong complications they are still recovering from. But let's look at the silver lining and how can we use this opportunity created by COVID for improving healthcare.
You covered various points there, sir. It was quite elaborate. So, moving ahead, what is the one thing that you wish we could change in Indian healthcare in the future?
One thing which I will highlight is you can integrate seamless healthcare, if we can use the word, from home to hospital and back to home. Only those who need health care in the hospital will get the doctor who is treating you at home is the same doctor who will get you in the hospital. So that's one thing, and we are struggling. You go to a doctor in the outpatient, you go to hospital, another doctor sees you, you have to repeat the whole story all over again. So that seamless integration of healthcare services, I am seeing, will be one byproduct of COVID.
Moving ahead, as we've been talking, we've observed so many innovations through this pandemic duration. So my question to you is, would you like to highlight some innovations that you saw during the last year that you find promising?
Yeah, and I will go beyond the last 1 year. There are many innovations which, when I was working at NHSRC in the technology innovation, one is you have non-invasive hemoglobinometer. Now when you want the hemoglobin, you have to go, somebody takes your blood and test the blood for hemoglobin. You can have a device with which you touch the skin and you get a reading of hemoglobin. Similarly, non-invasive glucometer, you can get the blood glucose level through a touch device. So these are two examples I can give you which we have, and COVID has given us opportunity to scale up some of these devices which we already have.
Now, as we've been talking about healthcare innovation, would you like to share some of your own work linked to healthcare innovation?
Yes. No, I can go on and on, but to be brief, when I was at the National Health Systems Resource Center, the technical support body of Ministry of Health, Government of India, we had put in place a system where any innovation then anywhere in India could be uploaded. And we had this portal is active now. Earlier we used to go and collect, visit states and get them what are the innovations you are doing, evaluate them, and then see if these innovations are replicable, they are addressing burden of disease, and they are cost effective. Now all these innovations, both program and technology innovations, are uploaded on this platform, and it has the roll down drop down menu. You upload it, and then the team and National Health System Resource Center takes up. They go through what is uploaded, look for independent evaluation. It has already been done and uploaded. If not, independent evaluation is done. And if the criteria I mentioned earlier, if it is cost effective, it is addressing burden of disease, and it is replicable, it can be scaled up in the country, these are shortlisted. So every year there is a conference in which all these innovators are invited. The health minister himself has been chairing these meetings, and the other states who are listening to them are then asked to identify which innovations they want to replicate and scale up in their state, and the government gives money for scaling up these innovations. So the funds are available from Ministry of Health, Government of India, for scaling up these innovations. So that's one example I feel satisfied we were able to put in place.
Now, moving ahead, as you stated your elaborate career path, I would like to ask what inspires you in your work, or any individuals you idolize, and why?
I will talk about two individuals. One is my family physician when I was a child. When anybody at home was sick, and a child goes and tells this doctor, so and so, he was doctor in our neighborhood, and we will go, one of us will go tell him, and he will come on his bicycle. Many times we will be sitting on the pillion seat of the bicycle, and he will come home with us and bring all the medicine. look at the patient, any investigations. Those days, some basic investigations doctor used to do himself. So that is one person I have in mind who motivated me to come to this field of being a doctor. Second person who I reflect on was Director of All India Institute of Medical Sciences, Dr. V. Ramalinga Swami. And that time he has passed on now, I think about 4 or 5 years back. I remember he took a class. I'm talking about 40 years back. He took a class in which he mentioned a vaccine will become available which will act against many diseases. We are still moving in that direction. So you put in all those antigens around one molecule, you inject that, and it gives you immunity against many diseases. So that's technology in action. And we have seen how fast we have developed vaccine against COVID in the COVID outbreak. So we are moving in that direction, but you need somebody to have that vision. Yes, this is possible, and one day we will do that. Recent progress in medicine and healthcare has been because of application of technology. Not much of basic research, but lot more of technology application in healthcare.
Going to
Yes,
the
Rohan.
next question, I would like to ask any book or resources you would like to share with our listeners that you have found enriching in general or focused on healthcare.
Thanks, Rohan. Yes, it's an important question. I will request you and Sanjay God to dig out the article on technology to rescue in one of your issues of InnoHealth magazine. And that article gives you comprehensive comprehensive overview from keeping people healthy, how technology is going to help us. Second, those who have risk factors, how technology is going to help in identifying those and giving them health promotive messages. Third is those who have the disease but don't know they have the disease, how technology is going to help us in detecting disease early. And the fourth is hospital care. How technology is already not going to change in future. Many interventions are already there, and that's how this article gives you comprehensive overview of prevention to hospital care, in between primary health care, and so on. So if you can make that article available to the viewers, I'm sure it is on your website. Sanjay can help you in locating
Sure,
that
sir.
article.
We'd
Thank
make
you.
sure that we pin it down in the description. So for my final question, I would like to ask, where can our listeners connect to you?
We can connect through InnoHealth, and they have all my contact details. If you want to write to me directly, I will slowly speak my email ID: DrSanjivKumar That's my complete name, Dr. Sanjiv Kumar Dixit @gmail.com. You can write to me, and we can continue this dialogue in future, or get through to any one of these young smart guys who are the forerunners in identifying and innovating and spreading all the innovation to improve healthcare, and they from InnoHealth can get in touch with you, and we can continue our dialogue there. Thank you, Rohan.
The link to connect with our guest speaker, Dr. Sanjiv Kumar, will be down in the description. Before concluding, I would like to thank Dr. Sanjiv Kumar for joining us and sharing your perspective. It was a pleasure having a conversation with you, sir, and it was an enriching experience too. Thank you, sir.
Thank you.
To conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. If you have a healthcare innovation journey of your own, do connect with us. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host, Rohan Tundell from InnoHealth Magazine Studio. Thank you.